goes into everything that's going to be taken away. So I don't put this on here to expect you to read everything and know what all this is, but just to say that this is a lot of stuff. And I want to just pull out a couple of the main things that we all kind of know about, which are the premium tax credits and the cost sharing reductions, which is what makes the insurance affordable. The individual responsibility mandate, which means that everybody is responsible for buying insurance, and Medicaid expansion, which of course here in Tennessee we do not have, but it would prevent new states from getting Medicaid expansion. And that's not even all of it. That's another page of all the things that would be cut in that budget reconciliation. And again, these are only things that affect the federal budget. You can only have something in the budget reconciliation bill that will affect that federal budget. But this is a lot of stuff that affects the federal budget. So what does this mean for the country? I think this is a really interesting graphic. This is a poll that was done by Kaiser that shows so people who voted for President-elect Trump, this shows how they feel about some of the aspects of the Affordable Care Act. And so you can see that over 80% of Trump voters think that the parents' insurance till 86, you can stay on your parents' insurance until you're 26 years old. They all support that. Everybody supports that. The insurance exchanges, everybody supports the insurance exchanges. That's 72% of people who voted for President-elect Trump want there to be exchanges where people can buy insurance. And then you go down to preventing or prohibiting the denial of coverage. 60% of people who voted for President Trump think that you should be able to get coverage even if you have a pre-existing condition. So there are a lot of aspects to the ACA that everybody wants to save. Everybody agrees with. Everybody thinks that the Medicaid donut hole should have been closed, that there should be the preventative services, that you can get those things for free. But the question comes down to, if we want all these things, how do we pay for it? And so there's something that's called a three-legged stool that is helpful to think about how we have a health insurance plan that works for everybody. And basically the idea here is that you need all three of these legs in order to have a plan that will be affordable and effective. So you have to have, if you want to have pre-existing conditions covered, which 60% of people who voted for President Trump do. If you want to have premium subsidies, which 72% of people who voted for President Trump do, then you also have to have a responsibility for everybody to have coverage, because otherwise you end up in something that's actually called the death spiral. That is not just something that I made up. That is something that's the name of it, the death spiral, where you have too many people who need insurance, who are very sick, who get insurance, but you don't have healthy people to help pay for that insurance. So if you're saying that, yes, we think that everybody who has cancer should be able to get health insurance, and you're saying, yes, I think that we should have an exchange where people can buy affordable insurance, then if you don't also have a requirement that healthy people have insurance too, you end up in that death spiral where the insurance company, the premiums skyrocket, the insurance companies can't sustain themselves. And so if we're looking at plans like President-elect Trump has said, where we're keeping these things that everybody agrees with, but then we're not requiring people to buy into that system and have the responsibility of having insurance, and that gets a little scary. So I don't mean to harp on that, but I think it's just important to know that there are parts of the ACA that everybody wants to see happen. But once you get into the difficult question of how you make that happen, that's not something that can just be done quickly in a replacement plan. That's going to take time. And just to talk a little bit more about what this means for the country, if we repeal the ACA without having a replacement in place, these are a couple of facts that are nationwide. So 22.5 million people would lose their insurance. And that's because the tax credits would be over Medicaid expansion and the individual mandate. That would also mean that 7.3 million people would also become uninsured because of that death spiral, because you have all these people who now are the insurance companies are trying to cover these people who are sick because now they have to because that's part of the law, but they don't have the means to do that because they don't have healthy people in the pool as well. We're also looking at $1.3 trillion being cut from federal spending on healthcare over 10 years. And then looking at what happens in states, a total of $1.1 trillion that the states will have to go back to providing, or localities or providers of care, because there's going to be so much uncompensated care, because you just lost insurance for almost 3 million people. That's going to go back on the states. So what does that mean for Tennessee? First of all, 526,000 Tennesseans stand to lose their health coverage. Um, so that means the uninsured rate will increase by 79%. And that means that the 203,000 Tennesseans who received financial assistance will lose that financial assistance. So again, this is what would happen in Tennessee if we repeal the ACA and we don't have a replacement plan in place. And so to kind of put a face to what that means, this is Kristen. Kristen has a congenital heart failure, and she has actually benefited from the ACA in 3 different ways. The ACA came into effect just when she was turning, or just in time for her, she was about to lose coverage from her parents' insurance. When the ACA went into effect, she was able to stay on her parents' insurance until she was 26 years old. And then because she has a pre-existing condition, not only does she now have she can't be denied health insurance because of this pre-existing condition, she was also able to buy insurance for an affordable rate on the marketplace. So in those 3 ways, the Affordable Care Act has made a huge difference for Kristen and her health and what she's able to do. And this is a quote from Kristen. She said, "Having the ACA has given me such peace of mind because with my heart condition, my next open heart surgery could be in the next couple of years or in 10 years. With that broad range, I like knowing I'm covered for surgery and the tests needed leading up to surgery." And so for Kristen, the ACA has made just a world of difference. Um, so thinking about the economy as well, when you're looking at taking away all those federal subsidies, part of the budget reconciliation bill also had cuts to Medicaid, to CHIP. CHIP is the Children's Health Insurance Program that covers children who need health insurance. When you're looking at getting rid of a lot of that funding, over the next 10 years, actually that's 9 years, over the next 9 years, Tennessee's economy stands to lose $27 billion over the next 9 years. And I mean, that's kind of self-explanatory of how devastating that is for our economy. To lose all that federal money that's coming in, that's helping our people get insurance, that's helping our hospitals, that's making sure that kids are able to get the care that they need. That's really devastating. And then also kind of going back to Kristen's story, 2.8 million Tennesseans with pre-existing conditions could be denied affordable comprehensive coverage if we repeal the ACA without replacing it. And obviously that's heartbreaking because these are people who have asthma, diabetes, cancer. These are all considered pre-existing conditions. And so if we end up in a situation where we repeal the ACA, and we don't have a replacement plan in place when we repeal it, and 3 years down the road we can't find a way to create a replacement plan, we lose all these aspects of the ACA that were so important and that everybody agrees with. And so that affects 2.8 million Tennesseans. And to tell you another story, this is Christina. Christina had breast cancer 3 years ago. She's in remission. She won her fight with breast cancer. She has a daughter. She lives over in the Knoxville area, and she and her daughter are insured through the marketplace. And because she had breast cancer 3 years ago, if it weren't for that fact that she can no longer be denied coverage because of a pre-existing condition, then she would not be able to have health insurance. She's in remission from cancer, and she would not be able to have health insurance if it weren't for that clause. So this is something that she said. She said, "I have a pre-existing condition, and without that in the law," she means the pre-existing condition clause, "I would never get insurance coverage ever again. I had cancer." So we're talking about people who undoubtedly deserve to have access to healthcare. And then another aspect of what this would mean specifically in Tennessee, this would, if we repealed the ACA, we didn't have a replacement in place, means even more hospitals are at risk of closing with reductions in federal funding and the drastic drop of people with insurance. So already in Tennessee, we've seen 4 rural counties who have lost their only hospital. And we have over 40 hospitals that are at risk beyond that. And we've seen this as we've talked. I mean, many of you have heard us talk before about Insure Tennessee, or the 3-star health insurance pilot of closing the coverage gap. These hospitals, one of the major reasons they closed is because they had too many uninsured people. Well, now we're looking at increasing the uninsured rate by almost 80%. That's going to be so dangerous for our hospitals, and especially our rural hospitals. So this is Alicia. Alicia was a nurse at McNary Hospital, and she lost her job when McNary Hospital, which is down in West Tennessee, closed last year. And she said, if McNary Hospital had not been there, my daughter would not be alive. Her story is that when her daughter was a toddler, she fell and cut her head open pretty severely, and was bleeding severely. And she was able to get to McNary Hospital, which was very close by. If she had to drive an hour to get to the next hospital, which is what she would have to do now because McNary Hospital is closed, her daughter would not have survived that drive. So that's just a little snapshot into how vital it is that we have these rural hospitals for people. And again, when we're looking at having an extra 526,000 Tennesseans who don't have access to insurance, who are uninsured, that's very dangerous for our hospitals. And in case that wasn't enough information, there's a little bit more. So we had talked about in the beginning how there are 3 aspects that we want to talk about. We would talk the most about the Affordable Care Act. So we talked about that, but we do also want to just touch on TennCare, which is our Medicaid program, and Medicare. Again, the Affordable Care Act is really the sprint that we're talking about. So when our legislators are talking about repealing it, they're looking at doing that very, very soon. And so that's why we want to spend the most time talking about that. But it's also important to know that there are other threats that are coming to our healthcare system, to these bipartisan pillars of our healthcare system that has been here for over 50 years. So we're just going to talk about those briefly. So TennCare, the threat is that block grants would drastically reduce funding to TennCare. So essentially, our legislators are talking about having block grants or per capita caps. Both of them would essentially mean that the federal government will write a blank check to Tennessee, and for a block grant, that amount of money that we get would not increase even if we had more people enroll in our programs. With a per capita cap, it would increase based on enrollment. But for both of them, it doesn't matter if medical inflation skyrockets. It doesn't matter if all of a sudden there are new drugs and they're more expensive. The amount of money that we receive from the federal government would always stay the same. So it would be a drastic cut in federal funding. So to break down a little bit more what this would look like, it would mean what they keep saying is that it would be more state control and flexibility. So more ability to have things like work requirements. They would be able to have caps on enrollment. So you get more flexibility, but that flexibility comes with a lot of problems. So like I said, less money from the federal government, which would mean more money coming out of the state budget. If we're receiving less money to cover people, that means we're going to be spending more money from our state budget to try to cover them. And that means that money's got to come from somewhere. So that's either going to come from raised taxes here. Because we don't have an income tax, it's probably more likely going to come from things like education and roads and other parts of our state budget. It also means that thousands of fewer people will likely be covered because with less money coming in from the federal government, even if we're having to pull money out of our state budget, we're going to have to cut people off the rolls. Dr. Wendy Long, the the director of TennCare, has said that they're looking at having skinnier packages if they have block grants, so that people will have less care. They'll have less benefits to their health insurance. And also there's little to no accountability. If we have a block grant, then the federal government isn't saying, okay, is this working? Is this something that is covering more people? There's no accountability there. And it also means that there could be cuts to provider compensation. Once we start getting less money from the federal government, we're most likely going to also have to cut what TennCare gives to providers as compensation. So if nothing else on this list that jumps out to you, let it be that there is less money from the federal government coming in. That's really the most important thing with block grants, is that it means less money. So what does this mean for people who have TennCare? There are 1.5 million Tennesseans who have TennCare coverage. That includes over half of the state's children. That's 830,000 children. Half of the state's births are covered by TennCare, and half of the state's nursing home residents. So these are a lot of people who have TennCare coverage, and if that starts changing because we have a block grant, we have to cover less people, we're giving skinnier packages, that affects a lot of people, and that affects the economy in ways that we can't even understand, because it's affecting that for 1.5 million people. That's almost 20% of Tennessee's population. And then we also have patient safeguards through TennCare. So that means that children have higher standards of care, and that means that nursing homes have minimum safety requirements. So again, just to tell you about someone who has TennCare and what would it mean if he didn't. This is Dorian and his mother, Jennifer. And when Dorian was 13 years old, he was hit by a train. And he was on TennCare at the time, and so he was able to get the care he needed quickly and effectively, and he was able to get into therapy. But if he hadn't been on TennCare, if he was uninsured and he didn't have the ability to get that care quickly when he needed it, the results would have been so different from where he is now. So this is a quote from his mother, Jennifer. Basically, she says that the first 2 or 3 months of rehab were over $600,000, and now that he's been able to get that care, she says Dorian now has the opportunity to not need as much care and not be a drain on the system, on society. Without the rehab afforded to him by TennCare, he would have been in long-term care. So just thinking about what that means when we're able to make sure that people get the care they need when they need it, it can save us money way down the road as well. So last thing I want to talk about before we move into questions and action items is Medicare. So like I said in the beginning, Secretary Tom Price, or soon-to-be Secretary Tom Price, has talked about privatizing Medicare for our seniors using vouchers. We don't have a lot of information on this right now, but we do know that there's a major overhaul anticipated as soon as 2017. We know that Tom Price does want to privatize Medicare, which would push more of the cost onto seniors. And we know that Medicare is a major financial pillar to our healthcare system. And so just like with TennCare, small changes that you make in the Medicare system would have far-reaching consequences that we might not even be able to recognize now. And there are about 1.2 million Tennesseans who are on Medicare. So before we move into the inspirational action steps and how we can all make a difference and how we can make sure that this is not an inevitable fate, I do want to pause for a couple of minutes to take questions and make sure that everybody is we're all on the same page. We all know what things look like. And I dragged in people much smarter than me who have a law degree who can help answer all the questions that I might not be able to. So if you do have questions, please put them in the chat box. Do we have any questions? Oh, I'm sorry, put the questions in the question box. Okay, so we have one question. Will the U.S. House Senate pass the bill first and then send it to the, will the U.S. House pass the bill first and then send it to the U.S. Senate? Is it safe to assume that the U.S. Senate will likely modify the House bill to not make the big changes that the House wants? Gordon, do you have an answer to that?
Hi, this is Gordon Bonneman. It will almost certainly pass the House. Well, all financial matters under the Constitution have to originate in the House. So it will start in the House. given the strong control of House Speaker Ryan, it will pass there without, I think, any adjustments at all to what he and the Budget Committee proposed. Then it will move to the Senate. The Republicans have, I believe, 52 seats. They need more than that to invoke cloture and cut off debate. That is to prevent a filibuster, but they can move through the budget reconciliation process with a simple majority, and that will work for repealing the guts of the ACA. So they can, unless there are Republicans who are concerned about this and raise a red flag to say, wait, let's be careful, it will fly through very, very quickly. It will happen, I think it's a given, it will happen in the House. The real action is in the Senate, and that's why Senators Alexander and Senator Corker are so very important, as we'll discuss.
Great. Thank you, Gordon. And one other question that we had, or statement really, is that on that poll, just to clarify, on that poll that I showed, that is only a poll of people who voted for President Trump. And so if you look at what that means, it's actually a much higher number of people who support those aspects of the plan. So thank you for pointing that out. That is, so actually the percentages of people who support those aspects is much higher. That is just looking at people who voted for President Trump. And then we have a couple of other questions. One question is, hasn't President-elect Trump stated that nothing will be repealed until there is a replacement that would go into effect simultaneously? If that's the case, would the Senate pass and Trump sign a budget reconciliation bill in January or February? Do you want to take that, Gordon?
Yes, President Trump has said that, but he's also said he intends to repeal it first thing in office, and it's unlikely that it could move through, that a replacement could happen on that time frame. So I think we should assume that, again, the action is in the Senate and that he will sign whatever is sent to him.
And then we have one other question before we move on to action steps. So Gordon, I'm going to read out this question for you. It's about the premium tax credits overpayment and the IRS rule on limit on recovery. If Congress eliminates this rule effective for the 2015 tax year, will it affect people who file a tax return before the bill is passed?
I think the answer to that is we don't know. Certainly, I don't know. There's just no way. Those kinds of details are unknown at this point.
Okay. And, oh, I didn't realize that I could scroll down. Oh my God, there's so many other questions. Excellent. Okay. So there's a question. Gordon, can you clarify the Medicare donut hole and what the ACA did for the Medicare donut hole and what it means if the ACA goes away?
Yes. The drug benefit, Part D of Medicare, when it was passed a number of years ago, well before the ACA, to finance it, it provided coverage for prescription drugs for seniors and people with disabilities on Medicare up to a certain income level, and then they would be without coverage until their pharmacy bills hit a very high level, leaving them with a very high exposure to pharmacy costs. That was known as the donut hole, and the Affordable Care Act gradually closed that. So if you repeal, and by that I mean it didn't leave people in that gap without coverage, and it provides continuous coverage without having to go essentially go bare for costs above a certain level, and that's been a very, very important protection for seniors, which is part of the ACA and is subject to loss if it's repealed without a replacement.
Great. Thank you, Gordon. And then another question, can you talk a little bit about, so we talked about the repeal of the ACA and we kind of touched on Medicaid expansion in that, but can you give just a brief update on what that means for the 3-star health insurance pilot, which is the plan that was created by a task force to close the coverage gap. So to make sure that all Tennesseans had access to health care. There was a task force meeting about a month ago. Can you just kind of give folks an update on where that's at and what we think will come of that?
The good news is that the chairman of the task force, Representative Cameron Sexton, has said that he intends to continue to pursue this. The task force and Speaker Beth Harwell have both spoken in terms of the fact that the need for covering people is still there. And in fact, the threatened repeal of the ACA makes it particularly urgent that the state go ahead and elect that option. The plans to repeal would leave the actual coverage in place for a couple of years in most probability. Nothing is certain, but that's the most likely scenario. And we would want to make sure that whenever it is replaced, it's likely that it will keep in mind that a majority of states, including a substantial number of Republican states, have expanded their Medicaid programs, and their members of Congress, their senators, will be trying to make sure that any replacement recognizes that and protects that to some extent. We want to be included in that number. So the argument is we need to go ahead and pass the three-star pilot so that we don't lose the $1 billion a year that's available under the ACA, so that whenever the replacement is passed, whatever it contains, we're treated as one of the states that keeps a high level of federal support for coverage. That's part of the argument also to Senators Alexander and Corker that we haven't done that yet. Please don't be rash. Make sure that the replacement keeps the door open for Tennesseans to get that our share of the federal funding to cover people in the coverage gap.
Great. Thank you, Gordon. And I'm just going to go through 3 more questions quickly, and then what we'll do is talk about how we make sure that all these things that we laid out don't actually happen, because we're working together and we're showing our power in that way. So one quick question is it likely that Representative Tom Price will be confirmed? So every cabinet member has to be confirmed by the Senate, and it is likely that he will be confirmed. We haven't heard opposition to that. So he will be the Secretary of Health and Human Services. And then 2 more questions for you, Gordon. One is, what would the effect on behavioral health care look like? So there are a lot of block grants that we have in the state that help with behavioral health care that come from the federal government. What is the future of that?
Well, if you look, one reason why we're able to predict and give you specific numbers about what some of these policy changes will be is that House Speaker Paul Ryan was the former head of the Budget Committee in the House, and he has a very detailed plan that he has passed before and that was vetoed by President Obama. But now that there is a Republican in the White House and he is the House Speaker, and keep in mind again that financial matters have to originate in the House under the Constitution, we've got a pretty clear idea of what the targets are. And he intends to move trillions of dollars, that's trillions with a TR, out of domestic spending, both to finance tax cuts, to increase spending for the military, and to reduce the deficit. So when you look at the very aggressive budget reductions that are planned and the priorities of the new administration, really all domestic spending is facing very, very serious cuts. And so block grants are very much on the chopping block, and I think it's barring some really unforeseen change in the political environment and establishing a firewall that tells Congress that the public expects to maintain certain levels of service. I think the block grants are very much in peril. That's not to say they will go away completely, but they are likely to be cut very much, and that will come at a time when, of course, the major safety net for people with mental illness, which is Medicaid and secondarily Medicare, are getting hit. Medicaid first and foremost.
Great. Thank you, Gordon. And one last question that we'll address before we move on, and if I did not answer your question, we will definitely send out a response to as many questions as we can. And this kind of segues us nicely into the next section, is a question on just pretty much, we've seen bad things coming up before, changes to the Social Security system. We've seen block grants come up before and they have failed. Is it likely that this will be like that and this will fail? And I'll answer that, and Gordon, you can jump in if you have anything to add. I would just say that this is a whole new world, and we don't know, but if it's going to fail, it's going to be up to us to make sure that it fails, which is why we want to spend the rest of the time talking about what next, what does this mean for moving forward, and how do we make sure that this all doesn't happen. Do you have anything to add to that, Gordon?
Well, the bad news is that Katie says, and anybody that's been paying attention knows, we're in uncharted territory. The political conditions are really unlike anything in my very ancient lifetime, and so it's difficult to predict. The good news is that we can take some solace from the fact that, as the questioner indicates, there have been proposals before that have been defeated. I was around for those fights, and I can tell you the reason why they were defeated was not because the proponents backed up voluntarily, but because the public reaction was such that they were required to, and I think that's the challenge that faces us now.
Great. Thanks, Gordon. So let's get to the way more fun part, which is what do we do to make sure that, like Gordon said, we're taking action so that this doesn't happen. So it's important to know that this is inevitable. This is not, this is not inevitable, and we can change it. So we can change the trajectory of this. So we kind of laid out a couple of action steps that we think are going to be the most powerful. Really what has to happen are two major things, public education and constituent contact with Senator Alexander. So to start out with, there's a new coalition. These are organizations who are on this coalition. It's called the Great State Project, Tennesseans United for Healthcare. And our pledge statement is really that we believe that Tennesseans should have access to high quality, affordable healthcare coverage. And so these are organizations that have signed on to this so far, and we're growing every day to make sure more organizations are aware of what we're doing. So that's the Great State Project. And so I just wanted to make sure y'all knew about that. And the main thing that we're going to talk about in terms of taking action is this idea of no repeal without replace. So like we talked about before, they're saying that they want to have a repeal of the ACA, an essential repeal of the ACA. Again, it's through budget reconciliation, but it would get rid of everything that uses federal funding. And they would say, okay, we'll have that take effect a couple years down the road, and in the meantime, we'll come up with a plan that will work for that. And that's really scary for a couple of reasons. One is that, again, like I said earlier, that just creates a ticking time bomb for 60 senators to get together and agree on how we're going to do healthcare in America, and that's really scary. If you've been paying attention to the Senate in the last 10 years, you know that that's not exactly something that will happen, that they can come to an agreement on such a huge issue. So leaving that ticking time bomb that affects so many Tennesseans is really scary. And another thing that's important to think about, so you have 203 million or 1,000 Tennesseans who are on the health insurance exchange. If you have a plan that says we're going to get rid of those subsidies 3 years down the road, insurance companies don't really have a reason to stay in a marketplace that's going to be collapsing. So most likely what we would see is the health insurance marketplace as we know it would not be 3 years down the road that would change. That would start changing immediately. They're also talking about having the mandates, that individual responsibility, having that go away right away, which means that people would be leaving the insurance market, but the insurance companies would still be required to provide care for people who are sick without charging them more. So again, we're looking at that death spiral, not just happening in 3 years, but happening if this goes through pretty soon, which is a really scary thing for our state and for our country. So the solution to that is to contact our senators and our congresspeople and say, do not repeal the ACA without a replacement plan in place. We're not saying, we need to keep the ACA even. We're just saying don't get rid of it if you don't have a replacement plan in place. So the message there is that it's irresponsible to repeal the ACA without a replacement. Families who rely on this care deserve to know what the plan will be. They deserve to know what it'll look like when they lose their care, and to know that they're going to have something that will protect them and that they will be able to rely on. And one piece of really good news is that we're in a very, very powerful place in terms of making that happen, making sure that we don't repeal the ACA without a replacement plan. And that's because we have Senator Lamar Alexander as one of our senators. He is the head of the Health Committee up in D.C., and he has said we need to figure out how to replace it before we repeal it, referring to the ACA. He said that on November 30th, I believe. Since then, he's walked that back a little bit. He's made a couple of contradictory statements about whether or not he wants to repeal day one when President Trump comes into office. But he's on the fence about it. He has said this before, and we can get him to make sure that he stands by this earlier statement, that he says we cannot repeal the ACA before we figure out how we're going to replace it. So that's kind of our main goal, is to make sure that we're talking to Lamar Alexander, to Senator Alexander, and make sure that we're letting him know that we think we need to have a replacement plan in place. So that means we all need to take action, and we need to take action now. And we've laid out a couple of ways that we think are going to be the most effective ways to take that action. First is having a letter writing party. So we're really excited about this idea. We know from national experts, from legislators, from people on the Hill, that handwritten letters are one of the most important ways to communicate with your legislator. It's incredibly effective. They rarely get handwritten letters. They're used to getting thousands of emails, but they never get a handwritten letter. And so when we send handwritten letters, they actually get read and they actually get responded to. And so we want to make sure that he is getting as many letters as possible, old-fashioned handwritten letters that say, please do not repeal the ACA without a replacement plan in place. But it's kind of intimidating to write a handwritten letter. And most people, if you say, hey, will you write this letter? You go home, you kind of forget about it, you're on your computer, and you're not thinking about sitting down and writing that letter. So we think that one of the best ways to do that is to have a letter writing party. So we need to make sure that Senator Alexander gets hundreds of letters in his mailbox over the next month. And only you can make that happen by getting your friends to write letters. So here's the plan. On January 5th, the evening of January 5th, we're going to host a webinar. And in that webinar, we'll go over some of this information. We'll condense it a little bit. And then we'll give you advice on how to write a letter. We'll show you a template on how to write a letter, and we'll give you time to write a letter. And what we want you to do is to sign up to host a letter writing party. So that means that we'll send you a packet that has paper, pens, cards, information. We'll send you that packet, and what you need to do is invite 8 to 10 people to your house that night to have a letter writing party. So invite your friends, invite your families, invite your coworkers, and say, hey, I want you to learn a little bit about this information that I got about healthcare coverage. I think it's really important. I think you should know about it. And there's a great way that we can take action. Will you come, and will you do a letter writing party with me? Will you come to my party? And so we think that this is an amazing way to make sure that Senator Alexander gets those handwritten letters. And we think that this really puts it on our people to make sure that we're getting that, and that we are reaching out to our friends and making sure that our friends are engaged in this. So I'm going to pause right now and just see if see if we can get some people to say yes, I will host a letter writing party. And so if you are willing to host that party on January 5th, We will have a webinar. We'll send you all the materials that you need. All you have to do is invite some friends over, maybe make a pot of tea for your friends, and then we will give you everything else that you need to host a letter writing party. And you invite your neighbors, your friends, Democrats, Republicans, people who are in the Tea Party, everybody to come to your house to just think about this issue. So if you are willing to host a letter writing party, please put that in the question box and say, yes, I will host a letter writing party. So I'm going to give everybody a minute to just think about, is that something that you can commit to on the 5th to host that letter writing party and to make a huge difference? Because if we can get 30 people on this webinar to say, yes, I'll host that letter writing party, you host a letter writing party, and then you have 10 people at your house. If 2 of them say, I'll host a letter writing party too, we'll have another webinar the following week, and then all of a sudden we've doubled the numbers of letters that we've gotten to Senator Alexander. So we're really planning on this being throughout the month of January, and every single week we're doubling the number of people who are writing that letter to Senator Alexander. And so we're really thinking that through this way we can get hundreds of letters to him. So who do we have? Who can commit to doing a letter writing party? Excellent! Oh my gosh! Y'all are amazing. Okay, great. So we will reach back out to you this afternoon or on Monday to make sure you have all the materials that you need to do the letter writing party. We'll support you 100%. We'll have a phone call with you, and we'll make sure that we can get these parties started. So for those who can't host a letter writing party, there are plenty of other things that have to happen. One is that everybody should call Senator Alexander right after this webinar. So he needs to hear from us immediately. He needs to know that we do not want a replacement plan. We do not want a repeal without a replacement plan, and he needs to hear from us often. He needs to know that his constituents want to see a replacement plan in place before he repeals the ACA. He really needs to hear that from his people. And so right after this webinar is over, please call Senator Alexander. What we have right here, if you go to this website, and I'll send this out in an email right after the webinar, then you will be able to put in what city you're in, and then the phone number for Senator Alexander will come up, and then it'll have a script that you can read out, and then you'll also be able to put in a little text box what the response is. So then we'll know that you called Senator Alexander, and we'll know what his staff said. So this is super important that we're getting as many people to call Senator Alexander as we can. So please, right after this webinar, go to that website and call Senator Alexander. And then the third thing that we're giving as an action item is to tell your story. I mean, the way that I was able to, as I was going through how this affected individual people, those individual stories are so important to putting a face to the problem. So stories of people who are losing care need to be everywhere. They need to be in newspapers. They need to be on social media. They need to be people just need to be talking about that to each other. And it's much harder to cut people off care when you have to look them in the face. And so we need to put those faces everywhere, the faces of people who are at risk because of the ACA being cut. So if you or someone you know has a story to tell, please have them go to our website. You can tell your story there. You can send that to other people to tell their stories. If you have insurance through the marketplace, if you have a pre-existing condition, if you've benefited from the elimination of lifetime caps from the ACA, if you have benefited in any way from the ACA, please go to this website, tell your story so that we can share that with as many people as possible. And we will also have flyers. We have flyers that you can put around your town. We have all different kinds of resources to help you spread the word to share your stories. And so we will send those along in a follow-up email. If you have a clinic that's down the road, if you have a coffee shop that you go to, print out a flyer and put that flyer in the clinic or coffee shop to get people to connect with us and tell their stories. So those are our marching orders, because together we can make this happen. And this is not by any means an exhaustive list of the things that we can do, but these are just sort of to get you started. If you're thinking, I'm mad about this, I'm angry, or I'm sad, or I'm heartbroken, or whatever your feeling is, put that into action. And if you don't know what to do, here are 3 things that you can do. So you can sign up to host a letter writing party, or if you want to help host a letter writing party, or if you just want to send names of people who might be interested in writing letters, then let us know and we'll connect you with that. Call Senator Alexander as soon as this webinar is over and make sure that he's hearing from us. And then tell your story or find people whose stories you can tell. And you can get those at tnjustice.org/coverage matters. So I know that we only have about 5 minutes left, but we have some questions. And so I want to make sure that I hit some of those. And please do continue to put your questions in the question box and commit to these things in the question box. So Alexander, well, the question is, Senator Alexander has stated that the ACA shouldn't be repealed without replacement. And do you think that the Senate will pass without his vote? Which is a really good question. So essentially, there are 52 Republicans who are in the Senate. In order to pass budget reconciliation, they need 51 votes. And if there's a tie, so if it's 50-50 because there are 100 senators, then the vice president will come in and make a vote, and we expect that he would vote to repeal the ACA. And so that means that we need to make sure that 51 people do not vote to repeal the ACA. And there are 52 Republicans in office, so that means that we need to get 3 Republicans, just 3, to say, hold on, yes, we can repeal the ACA later, but let's have a replacement plan in place first. We only need 3 across the entire country. And so national partners have been looking at who are those 3 senators that we can find who are going to do that. There are 9 different states that they think that there are senators that can be moved on that. And Senator Alexander is really one of the top senators for this. So if Senator Alexander does not vote to repeal the ACA, then most likely Senator Corker will follow his lead, who's our other U.S. Senator here in Tennessee, because he often does follow Senator Alexander's lead on healthcare issues. And so just by getting Senator Alexander, you have 2 right there, and then you only need 1 more in the entire country to do that. And Senator Alexander is a leader in this. Like I said, he's the chair of the healthcare committee, and so it is just so vital that we are reaching out to him, because this is honestly up to us. This is up to us to make sure that he is hearing from his constituents, and he knows that this would be devastating for his state, not to mention the country. Okay, so other questions. So the, can you read these? So we have, so the letter writing campaign that we have, we're asking folks so the letter writing campaign, we want as many people to write letters as possible. And our thought is to help you do that with a party, but absolutely, if you are part of a church, if you're part of another organization that can gather together and write letters and make sure that we're getting as many of those to Senator Alexander as possible, don't wait for us. I mean, don't let us, don't wait for the webinar. If you have an idea on how to do that, we'll send you resources, we'll send you some drafts and ideas, and we'll make sure that you have what you need to get that going. So if you have thoughts about doing a letter writing campaign in another way, then please do. I mean, that's fantastic. And I think that churches especially are a great way to find people to write letters. Book clubs, if you have a book club meeting, ask them to all bring a piece of paper and talk to them a little bit and then write a letter. If you need help with, if you need one of us to Skype in, or if you need help with talking points, then we're happy to do whatever is helpful for you to mobilize your people. So we're at 12:58. I want to be respectful of everybody's time. So we're going to take one more question. So this says, budget. So the question is, when we're talking to Senator Alexander, if we're saying don't repeal the ACA before you replace it, are they going to be able to say, well, no, I'm not going to repeal it, I'm just going to put it through budget reconciliation? So do we have to be more clear to senators? And I think the most important, I think that a lot of them are kind of using budget reconciliation and repeal as synonymous. And so I think that the message of no repeal without replace gets the real message across of don't take away our care before you replace it. So we have a whole set of talking points that can help with different things that you can say and different facts that you can give that make it pretty clear that we do need to have a replacement plan before we begin the repeal process, because really the budget reconciliation vote begins that repeal process, and we want to make sure that we don't start that until we have something else in place. Um, so with that, we're at 1 o'clock, and so we're going to close out the webinar. But please follow us on our Facebook page. We're going to be sharing stories almost every day. We've been sharing stories of people who would be affected, and we're going to add everybody to our email list so that you continue to get updates on what's going on. And when you see those stories on Facebook, please do share them, and so that your friends are learning about this issue as well. And as always, let us know if we can help. We're here to support you. We're here to make sure you have resources and tools that you need. If you have ideas on how to move forward and how to connect other people to Senator Alexander, we're so excited to hear those, and we'll help in any way that we can. So just let us know what we can do to help you take action. And we will send out a follow-up email soon with a little bit of, with some links and some other ways that you can get involved. Thank you all so much for being here and for spending your Friday afternoon with us. We're so grateful to have such an amazing team of people working on this, and we're just going to keep on fighting. So have a great weekend, everybody.